Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy channel. I've been thinking for a while about doing a series of videos on Dr. Hahnemann's highly acclaimed publication, The Organon of Medicine. But then I realized that to review it from beginning to end would be a monumental project. So I settled on the idea of making an occasional video that discusses selected parts of the Organon in more detail. The final sixth edition of the Organon was eventually published in 1921, many years after Hahnemann originally completed the manuscript in 1842. I recommend that you read the book from cover to cover, and then do it again, and then do it again. For my purposes today, I'll begin at the beginning with aphorism number 1, which at first glance appears to be brief and simple, but upon reflection actually has a lot to say. But before I start, I'd like to read a quote from a 1976 publication of the Organon, translated by Kunzli, Naudet, and Pendleton. In the introduction, Dr. Joost Kunzli writes, "The Organon may in time be widely recognized as one of the most important books in the entire history of medicine, because it introduces in the long story of man's struggle against disease a successful system of medicinal therapy that contrasts radically with everything previously taught and practiced." So with that in mind, let's begin our study of the Organon. Okay, so the first aphorism of Dr. Hahnemann's Organon is very short and sweet. It reads as follows: "The physician's highest calling, his only calling, is to make sick people healthy, to heal, as it is termed." Now that sounds pretty clear and unambiguous. I can't imagine anyone would disagree with the idea that a physician's mission is to heal the sick. However, while aphorism number 1 is pretty straightforward, Hahnemann's footnote to the aphorism is a mouthful. It has a great deal to say. First, allow me to read the footnote to you in its entirety, and then we'll talk about it. It, meaning the physician's calling, is not to weave so-called systems from fancy ideas and hypotheses about the inner nature of the vital processes and the origin of diseases in the invisible interior of the organism, on which so many fame-seeking physicians have wasted their powers and time. Nor does it consist of trying endlessly to explain disease phenomena and their proximate cause, which will always elude him. Nor does it consist of holding forth in unintelligible words or abstract and pompous expressions in an effort to appear learned so as to astonish the ignorant, while the world in sickness cries in vain for help. Surely by now we've had enough of these pretentious fantasies called theoretical medicine, for which university chairs have even been established, and it is time for those calling themselves physicians to stop deceiving poor human beings by their talk and to start acting instead. That is, really helping and healing." End of quote. So the bottom line here is that while the aphorism itself defines what the physician's purpose is, the footnote defines what it is not. Now let's see if I can paraphrase this footnote in more succinct terms. The physician's role is not to weave together fancy ideas and hypotheses about the human body and the origins of disease. Neither is it to endlessly explain diseases and their causes, nor is it to concoct an abstract language or pompous terminology designed to impress those not trained in medical science. We've had enough of medicine's fancy talk and pretentious theorizing. It's time for physicians to do something that can actually help and heal. How many of you have gone to a doctor only to receive some fancy scientific explanation about the nature of your problem, and then were told that there's nothing that can be done about it, but that there is a drug that you can take on a prolonged basis that will temporarily reduce some of the discomfort, That is, if you can tolerate the side effects. This is what Hahnemann is talking about. He's saying that the mainstream medicine of his day amounted to a lot of talk and very little action. Let's review just a small sampling of some of modern medicine's fancy scientific lingo, designed, as Hahnemann suggested, to astonish the ignorant. How about diaphoresis? That means sweating. How about hyperhidrosis? That means excessive sweating. Do you know what polymyalgia rheumatica is? It's a term for widespread muscle pain and stiffness. One of my favorites is coccydynia. I once had a terrified patient consult me about his recent diagnosis of coccydynia. When I told him that it was just fancy medical lingo for tailbone pain, he breathed a big sigh of relief, and with that, half his problem was solved. So Hahnemann's point is that lacking the ability to make a real practical difference in many cases of illness, the medical establishment instead busies itself with creating a convoluted medical language designed to express all kinds of speculative theories about human illness. In other words, medicine in essence says, well, we can't fix it, but we can impress you with our fancy scientific descriptions and explanations. Dr. Hahnemann's critique of theoretical medicine was admittedly strong. Nevertheless, it was justifiable given the fact that he had discovered a healing methodology that is actually capable of making people well again. Compare this to modern medicine, which has the ability to help acute illnesses and emergencies, but only offers palliative or suppressive treatments to manage most chronic diseases. Furthermore, Hahnemann's use of the term theoretical medicine was no accident. He was highlighting a critically important difference between his new homeopathic approach and the prevailing medical thinking of his time. In actuality, the same type of medical thinking continues to this day, only now it is referred to as rational or scientific medicine. You may ask, what's wrong with being scientific? Hasn't it allowed modern medicine to advance in many ways? And my answer to that would be yes in some ways and no in others. Perhaps the best way to answer that question is to compare the two systems of medicine. The bottom line is that while homeopathy is both empirical and holistic, modern medical science is rational and reductive. They constitute two completely different ways of approaching illness. Let's take them one at a time. Homeopathy is holistic because it keeps its focus on the big picture at all times. A constitutional remedy is designed to treat the whole person, as if all of his or her ailments are one. And that's because, in reality, by definition, they are one. How could it be otherwise? After all of those ailments are happening to the same person. Homeopathy keeps an eye on the big picture even when treating acute ailments. A well-chosen remedy can resolve a flu, for example, while rapidly returning a person to better health. Whereas the allopathic approach to a flu is symptomatic only. An antipyretic drug, for example, can only lower a fever. It's not capable of treating the flu as a whole. Now, homeopathy is holistic and it is also empirical, which means that it is based upon observation and experience. The homeopathic system is built upon a solid foundation of centuries of observations made by countless practitioners and the reports of millions of patients who have firsthand experience regarding the benefits of treatment. Of course, observation and experience are bedrock principles of the scientific method, are they not? Observations are made, experiments are conducted, and the results or the experiences of practitioners and patients alike are documented. Dr. Hahnemann's provings are arguably the very first systematized scientific experiments ever conducted. The irony is that modern medicine also thinks of itself as empirical and evidence-based, when in reality it is nothing of the sort. It has convinced itself that it is based on observation and experience. However, many physicians seem to have little interest in hearing what their patients have to report about their experiences. In fact, medicine uses a derogatory term to refer to patients' personal experiences. That term is anecdotal. The medical establishment has nothing but contempt for anecdotal evidence, which it believes to be an inferior form of evidence. Now imagine a patient is prescribed a new drug. He then calls his physician to report an array of symptoms that developed within an hour of taking the first dose. The doctor responds by saying that those symptoms are not listed in the medical literature as side effects and tells the patient to keep taking the drug. I've heard similar stories from patients more than a few times. My point is that it is not possible to be empirical when one ignores the evidence represented by actual patient experience. So while Western medicine falsely claims to be empirical, what we can say with certainty is that it is reductive, which is to say that it focuses on very small parts of the overall whole. This especially applies to its research methods, which form the foundation of its evidence-based approach to healthcare. The problem with research trials is that they can only consider a small number of variables at any given time. The results, therefore, by definition, must be fragmented and full of holes. In this sense, allopathic medicine is reductive. It treats the whole as if it can be reduced to a small number of factors, and it often treats those factors as if they have no connection to all other factors. As a consequence, mainstream medicine has become a highly fragmented scientific discipline. It constitutes an ever-expanding array of specialties and subspecialties that, in most cases, rarely ever communicate with each other. It's easy to see why patients and their complaints would so readily fall between the cracks of such a fractured system. From a reductionist perspective, it's nearly impossible to account for the overall health and well-being of patients. Reductionist medicine turns out, in fact, to be the polar opposite of holistic medicine. Now, in addition to being reductive, Western medicine is also highly rational. Hahnemann used the word theoretical, but the two words have the same basic meaning. While conventional medicine wears its rational label as a badge of honor, I see it as a kind of egg-headed flaw that skews its ability to perceive reality. The fact is that allopathic medicine is deeply beholden to its logic-based theories, and those theories often take precedence over a great deal of empirical evidence to the contrary. Allow me to offer an example. One popular theory in medicine these days is the idea that the unexplained chronic coughs of some patients are caused by gastric reflux. Patients are told that gastric acid reflux can irritate the throat and airways, thus generating an annoying cough. The solution, they are told, is to take an antacid drug. Thus, patients are presented with a logically appealing explanation that is rather easy to visualize in one's mind. Explanations of this type can be quite satisfying to those who have a need to know why they have their symptoms. And the solution sounds perfectly rational too, doesn't it? Eliminate the acid and eliminate the cough, right? The problem is that I've seen quite a number of such patients in recent years, and I've yet to meet one who told me that antacid treatment eliminated his or her cough. I don't doubt that an occasional person can benefit from such an approach, but the vast majority do not. Nevertheless, for lack of anything better to offer, medicine tries to impose its pet theory on many who simply do not fit the profile. So what we have here is a prime example of rational medicine, or as Hahnemann put it, theoretical medicine. This theory regarding chronic coughs turns out to be a house of cards built on faulty logic and not on any actual empirical or scientific evidence. It's just another popular medical explanation, one that sounds both logical and plausible, and it's believable enough to have duped doctors and patients alike. By contrast, homeopathy does not rely upon some prefabricated theory about the supposed causes of chronic coughs. Instead, it must investigate the empirical facts of each individual case, knowing full well that there are no one-size-fits-all treatments. And it is not possible to choose a homeopathic remedy without consulting a patient about his personal experience and without knowing the symptomatic details regarding his cough. The bottom line is that while homeopathy is truly based upon empirical observation, conventional medicine is guided by an abstract framework of theoretical constructs that may sound logical or rational, but that ultimately fail to pass the smell test. The fact is that Western medicine as a whole is an enormous house of cards, built on all kinds of logical presuppositions, many of which turn out not to be true. How do we know this? Well, for one, conventional theories of disease and treatment are constantly changing. And the same is true of the evidence that medicine uses to support its theories. One research trial contradicts another, which then contradicts another, and so on. Medicine chalks that fickle changeability up to progress, but I see it as the inevitable chaos that results from a lack of reliable foundational principles. Medical science has created an illusion of scientific certainty built upon the shifting sands of faulty logic. The real question, as Hahnemann puts it, is whether patients are being helped and healed. When we look around at the millions of chronically ill people who are dependent upon drugs that generate so many dangerous side effects, the answer to Hahnemann's question has to be a very clear no. It turns out that rational medicine is a haphazard amalgamation of unreliable logical assumptions and theories, most of which have little to do with actual experience, and many of which have little empirical evidence to back them up. And I believe this to be true even before we factor in the corrupting influence of money, which we all know has had an enormous impact on the trustworthiness of so-called scientific medicine. Rational medicine is like the proverbial egghead, who relies so heavily upon logic to guide him that he ignores his own intuition and the evidence that he sees with his own eyes right in front of his nose. Dr. Hahnemann discovered a practical scientific method that was based upon empirical observation and the holistic inclusion of patient experience. Dr. Hahnemann was way ahead of his time. He saw through the fancy and deceptive scientific explanations fabricated by theoretical medicine. Hahnemann rightly criticized the false logic of rational medicine. More importantly, he refused to be duped by pompous hypotheses regarding disease that ultimately failed to live up to the one and only mission of the physician, which is to relieve suffering and to heal the sick. Okay, I hope you found this discussion illuminating. Thanks for watching. Don't forget to subscribe, and please tune in again to the next episode of All Things Homeopathy. May the vital force be with you.